Hello, it's Dr. Tamara Russell here, and I'm just answering some of the questions that mindfulness practitioners and clinicians were asking about using mindfulness for ADHD. So I've got the questions here, and I will just show them to make sure I can really get the question right. So one of the questions was about mixed groups. Do you think it's possible to run a neurodiverse mindfulness group that includes both people with ADHD and autistic participants, given that the ADHD practitioners may benefit more from verbal cues, whilst autistic practitioners may prefer more processing time and space? Yes, I think that's a really, really good point. The sort of quick answer, which I know may not always be practical depending on which kind of service you're working in, um, would be essentially to offer people whatever is the best option for them, particularly at the early stages of the training, where we want success, success, where we want a positive experience, where we want just enough reinforcement for the person to say, actually, this is going to be worth my while doing. And it just feels to me that if we put people that do potentially have quite different processing styles in that same group, lumped under neurodiversity, there's a chance that we're just replicating the same issue, which is people are going to have to compromise, people are going to have to adapt. They're not going to be able to have it in a way that suits their brain type, particularly early on. So, yes, I've had that feedback before. When I'm guiding more in an ADHD style with more frequency, a bit more directness, a bit more activity, which does support the ADHD brain, there are others that maybe say, oh my goodness, that was too much. I couldn't focus. She was talking too much. So I would say if you've got the possibility to do that, then I definitely would do that. But I'm aware that we have these sort of systemic and structural things that we need to deal with if we're working particularly in the statutory services. So that may not be possible. But if it's not possible, I think name it and name that we need to compromise and name that maybe we're going to do a practice now that perhaps is more suited to the minds that are very, very busy and will benefit from direct. And I would give the instruction like, if you don't like this, see if you can just tune it out. You know, this is the spirit of the exercise. This is what we're trying to do. Tune my voice out and you know, just try and do it. And then maybe another practice you could play around. But I think a really good exercise that I would get sort of my teachers to do is, you know, practice and record yourself doing it in those two different modes, and you could really get into that. That would be a good piece of professional development. Can you offer any advice or resources for a teenage girl who has been diagnosed with a verbal processing speed deficit and some ADHD traits, whilst also having very strong non-verbal reasoning abilities? What types of mindfulness practice might be most beneficial? This is quite a specific question. I think as a general rule, I would say keep that live laboratory of mindfulness concept in mind, the LLM. Everything's an experiment. So, I mean, how I would approach this is, I always really go with movement initially. Because movement is just often much, much easier for the large majority of people. I think I would start with movement. I would start with short practices. I would maybe give the option to feed back through the non-verbal means with body mapping, with drawings, using the diagrams and the four-stage model. So rather than relying on verbal feedback to help to understand post-practice, I would maybe go to the non-verbal means to help literally draw out the experience of the practice in a way where I can really kind of get a sense of what's going on for that person. Um, and yeah, lots of imagery, lots of symbols, using symbols and imagery as the prompts. Like I've got these pause stickers, which is a reminder to pause and slow down, using stickers and symbols as a way to prompt. But that tends to come after you've already done a little bit of the training. And testing, I think testing and setting out to test. Let's do some experiments. I don't know what's going to work for you. I got a movement one, I got a seated one, I've got a informal practice, I've got a formal practice. Let's have a go and see what happens for you. I think that would probably be my main approach. It's kind of always my main approach. Have you used the do nothing technique, letting go of the intention to control attention with ADHD clients? If so, what has your experience been? I do sometimes use an instruction where I might say release all effort. That maybe is similar to this, but this do nothing, maybe you have a particular thing in mind. But for me, as I read that, I'm thinking of the release all effort. And I would tend to use this at the end of a practice, particularly using it as a contrast device. So the brain is really geared up to notice contrast. So it might be the contrast between effortfully trying to maintain an attentional focus on an object. And you maybe would explore with like an easier object, the moving body, a harder object, the still body, and then release all effort and notice what happens, notice where the mind goes, notice what the experience is. So I would say in the situation of contrast, yes, just kind of sit and do nothing maybe would be tricky, but how I would approach that if I really said sit and do nothing, I have an exercise where I get people to draw their mental movements. So maybe I would allow them to do that. I would say do nothing, but I want you to have a pen on a piece of paper and start drawing. These are really, really fun exercises to do in the more creative mindfulness mode. Draw as your mind is wandering, just draw it on a big piece of paper. And it's really fascinating, and it opens up a whole a whole beautiful conversation about minds and mind wandering and all sorts of fun topics. How do you approach mindfulness retreats where they involve extended periods of sitting still and focusing on the breath? Myself, I suppose, I'm thinking as a practitioner. I mean, I've done a few of these. I love to go on retreat with Alan Wallace. I've done a few in-person retreats with him. I think mostly they're going online now, but this is kind of, it's traditional Buddhism, but he's sort of known for his teachings on shamatha, which is this attention training. So of course, I'm very interested in that. Um, yeah, I try my best. I try my best. And I know that the mind will wander. I use the four-stage model, so I don't get judgy or blamey if I can't do it. I'm creative with the objects that I might use. I try to stay with the spirit of the exercise, even if I'm not doing the actual exercise that everybody else is doing. So maybe it's a mindfulness of the breath, but if I need to go to a shoulder roll, I'll go to a shoulder roll. If I need to go to a mindful back twist, I'll do the stretching in a mindful way. So I'll keep with the spirit of training. I also would give myself permission to move if I needed to. I'd probably sit near the back. So if I had to get up and stand, I would be able to do that. If I had to lie down and do some point and flexing with my toes, I would do that. And I think the four-stage model has really transformed my ability to stay in those moments. But a funny story, which is one time I was at an Alan Wallace retreat, and by about day three, I was actually going quite mad. It was some very specific training, and it had clearly gone way beyond what my mind was able to do. So there was kind of like a lot of striving as he was giving this very precise instructions about, what the attentional focus was meant to be doing. I really couldn't do that. I mean, it was people with decades of practice. So I went for a run. And of course, I was busy admiring the beauty of nature and being present with the rabbits and the birds and the deer that I was saw as I was running. And I actually fell into a rabbit hole. So sprained my ankle. So this is my funny story about when I was on retreat and I fell into an actual literal rabbit hole when I was trying to get away from the rabbit hole of my mind. So, yeah, I mean, you need to take care of yourself. You need to know what your limits are. And I think, mindfulness is compassion and attention training. So it's balancing those two. And if you're sitting there going crazy, get up, get up and move. It's not meant to be a punishment. Don't give in too easily because that's not the spirit either. But work your edges in wise ways is what I would say. As an ADHD mindfulness teacher, I struggle with silent gaps when leading practices. What would you suggest? Well, I mean, I when I'm guiding a practice, I mean, I'm sort of 85%, 85% I'm doing it myself, and 15% I'm kind of like monitoring time and thinking about instructions and kind of doing that process of like translating my own experience into the sort of the relevant piece of guidance that I might give. So, I mean, I'm not using scripts. In BMT, we don't really use any scripts. I mean, we've got sort of practices that we like to run, but we run it from our own experience and we're actually doing it. So, I mean, in the silent gaps, for example, if my mind is wandering in a silent gap, probably what I'm doing in that silent gap is I'm noticing, like, okay, my mind has gone to thinking about what is my next instruction or how long is this practice, and then I would be kind of rephrasing that into the next piece of guidance, which is notice that the mind might go into planning. That's, I'm not going to say exactly what my mind is doing, but I'm noticing what is the property of the mind, and then I'm translating that. So, I mean, essentially, I'm being present with what's happening for me in the silent gap. And then I'm maybe just starting to do that translation process into, you can be pretty sure whatever's happening with you in that silent gap is quite likely to be happening to somebody else in that group. And the reason I'm sort of really passionate about this method of guiding is the closer I stay to my own experience when I offer that guidance, the more often people say, it was like you were reading my mind. I can't believe that you said that instruction because that was exactly what was happening for me at that moment. It was just uncanny. And again, to be clear, I'm not saying like my mind is doing this. I'm doing this bridging, this translation process between what I'm experiencing and then rephrasing it and just doing this little bit of adjusting, tentative, not it's exploratory, this might be happening. I'm not saying it's definitely happening. If I notice something about my hand is hot, I don't say like, oh, your hand might be hot. I say, oh, perhaps becoming aware if there's anything about temperature, warmth, or coolness, because I don't know, somebody else's hand might be cold, not hot. Um, so yeah, that's what I might be doing. And if you're not doing that, I would be exploring what's the struggle? What is the struggle? Is it in the body? Is it agitation? Is it in the mind? Is it mental activity? Is it a struggle because you're planning and rehearsing and trying to figure out what to say? And of course, again, compassion, important to just maybe offer yourself some kind words to say it's okay. But I think a beautiful opportunity there to really make high resonant connection to your participants because absolutely they're going to be struggling. They're probably struggling with silent gaps too. Yeah, noticing what fills the silence. Yeah, becoming aware of the bodily sensations and the mental activity when we're left with these longer gaps, staying interested in what comes up for you. Let's experiment again now. I'm going to allow a pause for you to stay in that practice of mindfulness of the posture and remain curious about where the mind goes when it's not where it's supposed to be. Oh, brilliant questions. Are there any particular recommendations for a teenage cancer survivor who also has ADHD? Um, well, I don't know exactly. Again, these are specific questions. So the sorts of things I would be thinking about here. Um, I would probably work initially with external objects rather than internal objects. Maybe some nature practices or some looking visual attention training practices, but like that tones of green exercise I did, showing visual imageries and using visual search, more of the kind of creative arts attention training practices maybe to start with, because you can keep the object external before going in. I would be holding awareness of the relationship to the body, particularly around where maybe the cancer might have been, and work with objects that are easier to work with, maybe, for example, like hands and face, and maybe work with soothing practices before focused attention training practices, to slowly befriend the body. I would hold awareness that there might be some iatrogenic effects post-treatment. So, problems from the treatment that may still be lingering. Certainly, maybe trauma if there's been surgery or long hospital visits, invasive surgical procedures or invasive treatments. Being aware that it would need to be a kind of medical trauma informed approach. If it's a teenager, maybe working with technology, using what they're already using, the technology, the phones, maybe using the phones to do some creative activities, photography, mindful photography, those sorts of things. Documenting, storytelling might be important, sort of like mindful storytelling and narrative work, with a hint of mindfulness. I'm thinking this is more sort of therapy work rather than standardized mindfulness, I guess. And I guess there could also be grief and loss work. If I don't know, depending on what's happening, um, how to how to let go of what was. And also just really recognizing there's probably still high levels of anxiety. So there'll be something about befriending the anxiety and working in that more health anxiety way. Um, yeah, but also celebrating, right? Surviving, really kind of celebrating, um, savoring moments that are positive, that positive events diary. I would really amplify that. Next question. What are your thoughts on short-term mindfulness practice repeated many times throughout the day as an approach for people with ADHD? Absolutely, 100%. That's like my whole approach. My whole approach is how can you weave these things throughout the day so that your whole day is a mindfulness practice? So, like, this is a simplification, of course, massive simplification, but let's imagine that the way we train mindfulness is we sit on a cushion and we train our brain, and then it percolates out into our life. So that's one way. So the way that I do it is I say, what are the things that we're doing in everyday life? What does it mean to be mindful? And how can we weave those two things together? So in the mindful movement workshop, I talked about camera out, camera in, wiggle the body, move slowly, move mindfully. I'm doing that every time I sit down. Literally every time I sit down. I sit down, camera out, taking a moment, pausing, have I got what I need? Camera in, how is the body? What do I need to do? A wiggle, a stretch, a shoulder roll, a neck tip, a massage. Move slowly, particularly if I am rushing or I'm anxious or I've got high emotions. Let me do 3 super slow shoulder rolls. Yeah, standing waiting for the kettle to boil. What am I doing? Super slow shoulder roll. Mindful weights. Mindful move, lifting my weights while I'm waiting for the kettle to boil. Yeah, it's a different way to do the training. So it's this, if we used a gym metaphor, maybe it's that difference between what they're now calling sort of functional movement practice versus going to a gym class. Yeah, so a gym class is like somebody else has designed something that you then have the discipline to go in and do it. Whereas the functional approach is, you're moving all through the day. And so where can you weight bear? Where can you increase strength training? What can you pick up? Bit like Bruce Lee, yeah. Picking up the shopping bag is kung fu. That's what I'm thinking. So absolutely. And how I work with this, with my clients, we have something called the compassionate to-do list. It's actually it's a bit more complicated than it sounds, but it's a training in how to organize your day to maximize exactly this and move forwards with care plus attention. Let's keep going. Specific risks or considerations. I think the thing is, don't underestimate the shame and the fear of failure and how that can be activated by mindfulness. I would also say don't underestimate the power of really how being seen by somebody without judgment can also almost produce that slightly backdraft experience. It's so moving for people with ADHD when somebody really sees them and says, no, you are totally allowed to be just how you really are allowed to be, just how you are. I mean, it really hits something quite deep inside. And, that inner child can be quite wounded. It maybe looks robust on the outside, but inside it's probably quite wounded. It's probably quite, carrying a lot of pain. And when that child is seen again, it can sometimes be, quite an emotional experience. And of course, to allow that in a mindful mode, but to be aware that that might happen. I guess we're interested in things like sensory processing differences, maybe hypersensitivities in some cases. So that might be something to just keep an eye out. We also know there's a high comorbidity of hypermobility. So that's why when we're doing the movements, it's really about, first we try to really go slow so we can go carefully. Because if there is hypermobility or sort of double jointedness, people might overstretch. I mean, I get round that by saying we're not in a we're not in a gym class. So I want you to actually do less and slower and less and slower and less and slower. And that is the training, actually. Do less, go slow. Pay attention, really be interested in the body. Don't go beyond your limits. Sort of hidden factors. I mean, it's quite possible there's comorbidities with drug and alcohol. Many people with ADHD are self-medicating in all sorts of ways. So there could be something around that. I mean, again, to not to bring it out and to shame it, but I've worked with many clients who are, trying their best to do what they can with the resources that they've got. And that often includes sometimes, drugs and alcohol used in ways that we would probably say are not the healthiest. But that's when we need to move our minds into that position of real non-judging. And just start to gently explore, the pros and cons of those behaviors and where might we replace them. And it could also be, digital addiction could be part of that as well. Do you generally recommend practicing with eyes open or closed? It's an experiment. Everybody's different. So let's look at the theory. I mean, depending on which kind of practice you do or which lineage you're from, you may or may not have been instructed to be practicing with eyes open or closed. So in shamatha, Alan Wallace is the way he teaches, you practice with eyes open because eventually you want to withdraw the visual stream. I mean, this is classical Buddhist teachings. So you practice with eyes open because you want to be able to be aware of the visual stream and be able to withdraw it. Myself, I find it very difficult to practice with eyes open because my brain is constantly being stimulated, and every sensation that lands in it triggers a burst of like 500 other sensations. So, with eyes open, it's pretty tricky. Now, as a facilitator, of course, I do need to open one eye every now and again, just check that everybody's there and doing okay. But what I found is the more I'm in my own practice, the better I guide and the more people stay with me. So my Brazilian student was sort of a bit alarmed when we went to teach at this community center, and many clients there with severe and enduring mental health problems. And he said, Tamara was sat there in a room full of people with psychosis and bipolar with their eyes closed, and he was a bit surprised. But I knew it was a safe environment, and it's a very particular environment, so it's not the case everywhere. But I know that I can guide better, and when I guide from a more embodied place myself, it resonates more. But we need to explore. We need to explore. So we've got options, haven't we? Eyes open, but just dropped, or closed. And in the I've got a sort of a training with the 4-stage model. I mean, that's one of the experiments that you do. Let's do an experiment. In that 4-stage model of focusing, mind wandering, noticing, getting lost, which one allows you to have higher quality focus? There's a couple of other pieces in there. There's one about feelings of safety. So some people may not feel safe to close their eyes, and they might need a bit of a discussion about how we're going to do that in a way that means you're not closing your eyes and then panicking that like someone's going to come behind you, or what's that noise. The other thing is, sometimes when I'm doing movement, somebody gave me feedback once and they said, I actually like it when you've got your eyes closed because then you're not looking at me moving. Many people in certain cultures, not all cultures, in certain cultures, people are very, they get very, they get very anxious, or they get very self-conscious about being seen moving. Anyone that's working with me, we got to work through that quite quickly. And that's also a huge thing that we can be interested in, isn't it? Like, wow, isn't that interesting? Like, I could do a beautiful shoulder roll that's going to make me feel good, and I don't do it because I'm worried about what somebody else thinks of me. Like, just to be a bit provocative there, like, really? Can we get into that a little bit? Can we explore that a little bit? This is about freedom, right? It's about freedom. Here's a beautiful opportunity. Like, this is good for me. This is going to help me. And it's not harming anybody. It doesn't even take batteries. It's powered by me and my brain, and I can do something to feel good. Can I just let go of that thought she's looking at me? So there might be something there about self-consciousness, but as always, explore, test, hypothesis. Keep it open, allow, share your own experience. Is it common for people with ADHD to experience feelings of sabotage, resistance, or rebellion during formal mindfulness practice? Yes. When we look at the so-called developmental disorders, this is kind of old school DSM language I'm using now. We've got the ADHD, and we've got the oppositional, haven't we? We've got oppositional defiant disorder in there as well, kind of quite touching up quite closely. And many people with ADHD, would say, have a bit of a kind of a rebel streak. If somebody says do this, they do that. There's also a lot of why monkeys, like, tell me why I need to do that. I'm not going to do it unless you tell me why. Somebody spoke about that at a meeting we did with the Sussex. She said, well, no, nobody told me, why do we have to have an alert, relaxed posture? And so, the person said, have an alert, relaxed posture. And then I was just sitting there going, but why? I don't feel comfortable like that. Why are you wanting me to sit like that? And getting agitated. Yeah, because we don't know why. So this may come in various forms, I suppose. I would say it's probably relatively common, but let's surface it. Let's bring it up to the surface. And I don't know if I would call it sabotage, but there is something that happens with ADHD, which is like when you're even really trying to be careful, often the opposite happens. I've found that in my own life. It's so painful because sometimes the times when I'm really, 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 really trying, it's the trying that makes the thing happen. And then it's really bad because it's like I was actually trying to do A, not B, and I just ended up doing B again, like, but worse. So there's some compassion around it, there's some exploration around it. And I think, the flexibility is important. We've got a core intention. We'd love everybody to be here. But if you're just with the spirit of the thing and you're kind of circling around, how can you be with me on this? How can you be with us in this practice? And if you meet the saboteur, the mental monkey that just says, oh, this is totally stupid and boring, often it's like, but check in with the motivation. Why are you doing this? I mean, the saboteur might be right. Like, well, why are you doing this? You don't care. It's not important enough. Okay, well, let's go. We got to step back. We got to go back, back to why. Why are we doing this? It's not sufficient enough why for you to do it. Definitely, you must stop then. Your saboteur is right. Why are you doing it? Yeah, don't do it. So is that constant meeting people where they're at, getting really curious, not being afraid of these mind states or body states, and just saying, yeah, tell me about this rebel mind. What is it saying? It doesn't want to do it. It wants to do it differently. Okay, how does it want to do it? Come on, your mind can think up some ideas. How might you do it? Let's get playful with it. Can you say more about rejection sensitivity dysphoria and its relationship to mindfulness practice? Well, yeah, I mean, this terminology again is a little bit new in the field, isn't it? It's not really something that we knew about. It's sort of like a expert by experience symptom, shall we say? Some curiosities about it, but essentially, it's nobody likes being not part of the group. I think we have this inherently across the board as human species because we live in large social groups, and being rejected by the group is a big deal when it comes to fitness and survival. And like many things with ADHD, it's a bit over the top in people with ADHD. It's a kind of a normal function of the human brain, but it's kind of just a bit extra and a bit big in the ADHD brain. So, how that thought, they don't like me, or they may not like me, lands in the mind isn't just a little drop and a pebble that you can just literally brush it off, brush it off. It lands like a nuclear bomb, and becomes all consuming. Um, and is it a thought? Is it a feeling? Is it a fusion of a thought and feeling? I mean, I would definitely say mindfulness practice has helped me to, discern the difference between, the thought, they may not like me, or do they like me? And that sort of kind of burning stab in the heart physical sensation that comes into the body. And of course, over time, those really get fused. So mindfulness helps us to de-chunk. Yeah, is it a thought? Is it a feeling? Is it an emotion? Like, which comes first? What order do they come in? How am I experiencing these? These are all things to be observed, engaged with, related to, in this mindful way. Passion, kindly, patiently, non-judgmentally, with curiosity. And I think it's a task for all adults, isn't it, to eventually come to a point where we care less about what other people think about us. Normally hits like around about 50 or post menopause. If you're a woman, it's suddenly like don't care, right? Because of the changes in the brain. And you're not, less mating potential. I mean, if you want to speak in biological terms. But, like many things, people with ADHD probably just have a bit more work to do. And that can be annoying, and that's kind of not fair. But I turn that into a kind of like, okay, this is a challenge. How are we going to do this? Like, this is interesting. Let me discover more about this part of myself that's so afraid of being rejected. And I want to befriend it. I want to get to know it. I want to see it coming, and I want to be able to manage it when it arises. So somebody noted they have ADHD, but they don't identify as a fast processor. Yeah, again, I think this is sort of a topic a bit maybe a bit beyond mindfulness, but essentially our task with mindfulness is to learn about how our mind moves. And it moves at different paces for different people. And I think the task then is to study it and to get to know it. And how do we get to know it? By watching it and observing it, and by choosing an object to focus on and then getting interested in how the mind moves away from that object and how the mind moves back to that. And we have different thinking styles, we have different processing speeds. So yes, I think if you are thinking about processing styles, you might be thinking about repetition of practices. You might be thinking about duration of time to let things land. Particularly if you're sharing concepts, they may need to be revisited. You might need to sort of use the spiral learning methodologies to kind of revisit things more often. And I would also just say, even ADHD brains that are fast, I sometimes say, like, we look fast, but we're actually slow learners. And I think that was the thing that really kind of came to my awareness the more I practiced was, even though my brain is fast and I'm going fast and my body's fast and my speech is fast, to actually learn it's a learning difficulty. It's a learning difficulty because the way the learning gets embedded is much slower. So again, just always stay curious and anytime I'm using a label, I'm always just like, what, throw the label away, ask a question, right? Throw that label away. I don't know what that means for you, right? I'm making a billion assumptions about what that means to me. We've got lots of literature, but we also know there's loads of problems with the literature. So it's like, what does that mean for you? How can we explore this? How can we do some experiments to try and make sense of what's going to work for you and what you might need? Can you say more about the mindfulness attitudes and how they relate to teaching and practicing with ADHD? So, I mean, are you talking about things like non-judging and acting with awareness and, I don't know, patience, curiosity, kindness? Yeah, all of them apply. All of them apply, I would say. Um, it's just how you apply them might be different. Um, what's generosity with ADHD? I mean, I always have this funny story that I tell, which is like, when I see that somebody needs help, I literally sometimes I can feel the impulse to go and do something. And I don't know if it's impulsive or if it's choice. So in a sense, there is a generosity, but it comes from impulsivity, which may not be wisdom, right? And I remember once I was on the bus in London and I saw a couple of tourists and they were trying to read a map and trying to figure out where to go. And I just literally felt it was so strong. It was like this impulse almost lifted my whole body off the chair, to like literally go and sit down next to them and be like, let me show you how to do it. And I'm sure that's a mixture of like personality styles and, personal story and experiences and ADHD all mixed together. But like, on the surface, it is a generosity, but it's also, there's an impulsivity there as well. So, it's like looking at kind of the interactions, I suppose. And, if patience is one of the attitudes of mindfulness, the patience, the allowing, and the opening, this is going to be at odds a bit with an impulsive style. But that's why I've spent my life developing tools to help me to slow down, right? Pause, camera out, camera in, slow down with the shoulder roll, transitional pauses, compassionate to-do lists. I mean, a large bulk of it is about structural supports for the brain and for my life processes to help slow me down so I can create those spaces because they're not naturally there. So I'm not sure if that was exactly answering the question. Let's see. Okay, so that is it. Yeah, so I hope you find those useful. And yeah, keep them coming and write more in the description below if you want some more.